Pressure injuries are preventable, but they remain devastating for the hospital patients and the elderly and can actually become life-threatening. Now, exacerbated by the pandemic, research in the International Journal of Nursing Studies has shown the issue is costing the health system billions annually. Well, Professor Mark Budge, an advisory board for Lenexa Medical and Clinical Director and Geriatric and Rehabilitation Medicine at Bendigo Health, says Lenexa have developed a world-first medical device undergoing trials at one of the largest regional hospitals in Victoria, Bendigo Hospital. The device, which is being developed in Australia, is a fabric-based sensor which assists clinicians by providing targeted real-time monitoring for patient position to enable personalised pressure injury prevention. Good morning, Mark. How are you?
Good morning. Very well, thank you.
Now, what a fantastic and much needed innovation here. How did it come about?
Well, it came about from actually a health need, that the system was being overrun by problems that we thought we could avoid, that is pressure injuries or problems with skin ulcers that develop, particularly for those who are immobile or unwell or frail in hospital or at home or in residential care facilities. So to that problem, we wanted to address how we might best avoid it. And of course, the way to best avoid it was to be aware of it at a very, very early phase before it became evident. So the chaps of Lenexa Medical set about working out the technology you've just mentioned in terms of a sensor layer of the lining of a mattress to actually indicate when problems were arising in terms of pressure on the skin at any part of the body. And that aligned with and added to by putting in risk factors from individuals for themselves to make it a very particular solution for each individual, meant that we could then trace what was happening with that person as they're on the mattress, whether that be in bed on a mattress or in a wheelchair after a spinal injury on a cushion. We can monitor that and hopefully forewarn them about the need to move, to decrease the pressure on that area, which is starting to accumulate pressure and may cause a skin ulcer or problem. So it came really from a clinical need. And then, of course, the excitement was the chaps from Lenexa Medical came up to Bendigo Health one afternoon with 20 other people to pitch their idea 3 years or 4 years ago. And I said, well, this is the one that a geriatrician like myself needs to help develop. So that's what happened. And I joined them to try and assist from a clinical point of view with what the workflows might be, how it might actually be deployed in health, but also more importantly, how it might also be deployed in the community. And that's where we'll probably actually start as much as anywhere else within the community in residential aged care, which today at the moment in Australia and worldwide is needing a lot of assistance with a lean labour force and difficulties with coping with all the pressures, particularly that COVID pandemic has brought.
Mm. Well, so this obviously has benefits for the patient as well as the clinician and the staff. Does it have a home application as well, do you think?
Look, I think it does for very particular people. So as I said, I think the 3 or 4 initial arenas for where it might be deployed best, firstly, in residential aged care, where there's a significant need and also a high-risk population. A lot of people are relatively immobile and they really do need to be monitored in terms of them spending long times immobile on the bed and not developing pressure areas, especially where there's few staff to check them regularly. This can alert those staff to prioritise the people that do need attention rather than having to round all the time to try and anticipate such a problem. The second place probably is in the home, particularly, as I said, for those who are relatively immobile or frail, spending a lot of time sitting or lying in bed or on a wheelchair. And these people, yes, do want to prevent these problems because they do, when they do present a terrible impact on their lives. You know, some people can have months where they're waiting for this pressure ulcer to heal. And indeed, it can stop them working if they're still working, or if they're not working at home, it can cause them to have to come into hospital for prolonged periods to help with the healing of that ulcer and the specific management of specialists in doing so. And that's a huge impact on their life and also on those around them, whether they be family or carers in a nursing home or whatever their circumstance may be. So yes, it's deployable certainly in the community, particularly in residential aged care, but certainly at home for frail elderly people particularly, or those who are largely in bed because of medical conditions. But secondly, and I guess most importantly to start with where we started with testing this, was within the frail population within our hospitals, on beds in hospitals who've come in unwell, spending long times in bed, whether that be in ICU or in the ward beds with older folk or those who are immobile for whatever reason, after an operation, for instance. And those are the places where I think the first need has certainly been seen to be demonstrated with these trials we've been doing, but also where the need exists and needs a solution.
I could even see an application for people who've lost sensation, whether it be through a spinal injury or anything like that, that are sat there because to be unaware of the problem beginning and going through until where it becomes a real problem, possibly septic, would be another great application.
Absolutely. And certainly we've actually trialled in people who have that background issues as well, whatever the sensory problems they have in detecting whether my bottom is becoming sore or feeling pressure on a spot that's particularly at risk, particularly if you're sitting down or you're lying down for prolonged periods. So it certainly assists those people when they don't have any other clues necessarily that a problem's evolving. And what happens is it's not till it's evolved and it's there that they recognize, oh dear, it's there. I've got an area that's gone from a red area of pressure to actually an ulcer, and then started to spread because I'm at risk of that spreading, either in terms of its area of the ulcer on the skin, or, as you say, with secondary infection that might come that causes sepsis and potentially life-threatening illness.
And the recovery period, when you only have the one option to be on that area, it must be really debilitating or further impacting when you must stay off of it.
Absolutely. And then you're in this constant reality for what might be weeks or months of rolling from side to side or getting pressure off that area or applying vacuum dressings and other dressings to it to try and help it to heal. And that is a laborious task, very labor intensive from a nursing point of view and a carer's point of view, and often requiring hospital admission and inpatient stay rather than being able to be addressed at home. So it's a very serious catalogue of consequences that happen once this is evolved. We need to avoid it.
Why Bendigo Health, Doctor? How did Bendigo manage to become the forefront for this amazing technology?
Well, I think it was because, as I said earlier, that we had people from the Melbourne Accelerator program come up, and there were about 20 people who did their 3-minute pitches, and we listened to them all. And I took away from that 2 that I thought had definite need that they addressed in a health need terms, particularly as a geriatrician, but secondly, but also had a solution that looked like it might have legs to get to actually a commercial reality with a bit of assistance from a health flow point of view. And so that's how it literally started. And I approached them, and then because I work both in terms of the geriatric medicine side of what I do, but also my interest in digital health technology and the enablement that provides to providing care to a region most efficiently and with equity of access. So with all those factors involved, I said, well, look, this is something that's worth definitely exploring. And for the last several years, we've been exploring how to best optimize that. And the chaps with their amazing technical abilities and also insights into how that might, if you like, juxtapose with the healthcare need has been the resultant technology that we have now that has now been approved for TGA device 1, initial device that can be deployed. And we hope into the future, we'll have it doing more than just monitoring for pressure ulcer concerns to avoid them, because the sensor mat actually has the potential capability, it's quite sophisticated, to potentially actually tell someone whether they're on or off the bed, whether they've been continent or incontinent during the night, what their heart rate is, what their breathing rate is, and potentially even to do a single lead ECG whilst they're lying on the bed without any wire being attached. So in terms of the non-obtrusive home monitoring that might come for those who need it long term, or for those we're trying to not have in the hospital but want to expedite their discharge to have them at home but still need monitoring, well, this might be one non-obtrusive way of helping them not only avoid pressure areas whilst they're not under very specific nursing care in a hospital, but also to look at the monitoring of their vital signs and other things, which might inform a clinician at a distance as to when they might need to intervene or when they might need to be in contact with their community carers, be they nurses or their GPs, to go and review that person in their home.
Wow, what fantastic technology we live in. I love the way Australia always seems to be punching well above its weight, especially in the medical field. Thanks so much for your time, Professor, and hopefully we'll hear back from you with some further updates.
No, look, thank you very much for the opportunity. I think it is but the first stage of what Lenexa Medical will deliver in connected care terms, and we'd be very delighted to come back when we can share more with you about its first deployment, and secondly, about its evolved scope of what it can offer into the near future.
Great. Professor Mark Budge, thanks for your time.